Did it take you a minute to get moving this morning? Is it because part of your body constantly hurts? Our first guest says living in chronic pain is not living at all. Get Physical RX addresses your pain in a number of ways with the goal of getting to the root cause and fixing the actual problem. We went to Get Physical RX where Dr. Jennifer Joseph shared a few of their methods and even tried something called dry needling on my sore arms, which are, by the way, no longer sore. Dr. JJ, we are so trained in society to go from one extreme to the other. Either everything is fine or straight to medication and surgery. Sometimes we forget about what it is that you do here. So explain how this is an important area to look at for people before jumping to some other things.
Well, physical therapy is so important because as a physical therapist, we are doctors, we understand the body, we are licensed in movement. And it's so important because skipping that jump and going straight to medication, we forget that our bodies can heal. Even if we go to medication or surgery, we still have to regain range of motion. We still have to regain strength. So physical therapy is so important because it almost helps you get back to your prior level of function without the medication, without the surgery.
We have medications that may cover up a symptom, so like out of sight, out of mind. But if you have an injury and you're just covering up the pain, it can get worse.
Oh, absolutely. It's always important to find the root cause. Just for example, dealing with knee pain, okay, you're a runner. A lot of times if you correct that muscular imbalance, that range of motion and that strength provides so much more function for you to be able to carry that run on without pain.
And doing those things also can keep you off of a walker and out of a wheelchair longer as we age.
Physical therapy is so important because it helps the body maintain its function musculoskeletally, but it also keeps you healthy overall.
It's what the body was meant to do. This is what you were meant to do.
Absolutely.
And you know, it's interesting when you look at the little things that happen along the way in life that really can determine what our career path will be. You were an athlete, track star,
yes,
and then you had an issue and it opened the door to what you do today.
Absolutely. So I ran track all my life. It was something that I loved to do and I was really good at it. Had a lot of potential, and then I end up tearing my hamstring, causing an avulsion fracture, so I tore it right off the ischial tube. So somebody who's a sprinter coming out of the blocks, can't do that no more, you know, can't run the curve, can't stride. It really did something to me mentally. I just thought I couldn't do anything else. So I ended up going to physical therapy, and I just had a great connection with my physical therapist. And it wasn't just she got me back to my prior level of function with the range of motion, with the strength, with getting me back on the track. It was she connected with me emotionally too.
Angela, what was your issue and how has physical therapy helped you?
All right, so I actually had a massive tear of my rotator cuff. Also had a minor tear in my bicep tendon as well. Physical therapy has helped me because I do competitive bodybuilding, and it's helped me to actually get back in the gym at a much earlier pace. I'm at this point 12 weeks post-surgery, and I shouldn't have been in the gym, but I've been in the gym already 4 weeks, thanks to Dr. JJ and her team here.
Carl, what brought you to physical therapy and what improvements have you seen?
Well, what brought me to physical therapy is I had COVID-19 back in January of last year, and it put me down so bad I spent over 30 days in a MICU over at St. Luke's. I destroyed all my muscles. I went from barely able to walk to be able to make 9 laps around the gym walking with a walker, but walking.
Dr. JJ, there's something else you do called dry needling, and we're going to do it on my arm right here, but what is that?
So functional dry needling is a neuromuscular technique. It's a type of manual therapy, and so it's not acupuncture, and that's the thing that people kind of confuse it with. Acupuncture stays along the meridians of your body, but functional dry needling actually goes down deep into the muscle. And so what it's doing is it's trying to take that muscle fiber that may be so tight or not performing to its full potential and kind of not pinch it, but when it goes in, it stimulates that muscle. And when it stimulates that muscle, it causes spontaneous electrical activity. So you get a muscle twitch. Once you get that muscle twitch, it's like the fibers align back properly to where they should be so that that muscle can perform to its full potential. How do you feel?
This, I had no idea what I was getting myself into, but it feels really invigorated right now, but didn't feel the needle at all. You have something else called dry cupping, which became really popular, or we found out about it because we saw athletes do that. What does that do for the body?
So cupping therapy, basically it's an old traditional Chinese method, and what it does is it helps bring out toxins and debris from an area where you're having dysfunction, whether the muscle's too tight, you're not getting enough oxygen, blood flow to that area, you're having restrictions. So what you do is you use a suction cup and you place it on the areas, for instance, let's say you're low back, dealing with low back pain, and you put it on those areas and you pull that suction cup and it holds it in place, and it helps improve range of motion, it helps with pain, it helps reduce soft tissue restrictions and improve mobility.
Overall, who is this for? Because this is not just like a regular gym, although we see some things in here that we see in a regular gym. Who is this for?
Physical therapy is for every system in the body, and that's what makes it a great profession. Here, we specialize in more outpatient orthopedic and balance and fall prevention therapy. So I see a lot of post-surgical patients, rotator cuff, total knees, cervical spine, lumbar spine. If you're dealing with their general aches and pain, it's so important. And the new thing about physical therapy that people may not know in the state of Texas is that we're direct access. So you don't need a referral to come and see us. You pick up the phone, call us, hey, I rolled my ankle, I want to come in and see a physical therapist. We are doctors of physical therapy. We are trained to diagnose and treat musculoskeletal disorders.
Helping the body to help itself. Dr. JJ, thank you. Again, you do not need a referral to get physical therapy. You can go directly to Get Physical RX, where they can pinpoint the cause of your pain and treat it. To make an appointment, call 346-386-6683. Again, that number is 346-386-6683, or go to their website at getphysicalrx.com.